your distance from others. That means working from home where possible and no visits to pubs, clubs, restaurants or theatres. Households where someone has symptoms of the virus should isolate themselves for 2 weeks. Our political editor, Gary Gibbon, has more.
Many people were locking themselves down before the government changed its advice. Commuters thin on the ground at Waterloo Station at 8 this morning. The Prime Minister, only days after signalling the time was not right to copy other countries and move to a lockdown, said that was what he was now urging on all age groups, those not at most risk and those in greatest danger.
In a few days' time, by this coming weekend, it will be necessary to go further and to ensure that those with the most serious health conditions are largely shielded from social contact for around 12 weeks.
And even if you're under 70, suffering mild symptoms like a persistent cough or high temperature, the advice has been ratcheted up.
If you or anyone in your household has one of those two symptoms, then you should stay at home for 14 days. That means that if possible, you should not go out even to buy food or essentials other than for exercise, and in that case, at a safe distance from others.
But for all in the country, he said, even those with no symptoms, the way you live should change drastically.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues.
The advice only last week was that banning mass events would not much help control the spread of the disease. Today that changed.
It remains true, as we've said in the last few weeks, that risks of transmission of the disease at mass gatherings such as sporting events are relatively low. But obviously, logically, as we advise against unnecessary social contact of all kinds, it's right that we should extend that advice to mass gatherings as well.
The government said London's infection rate was racing ahead of the rest of the country. That had brought forward the date of a crackdown that might have come later, but one which is for now strong advice, not a change in the law.
I think most people would accept that we are a mature and grown-up and liberal democracy where people understand very clearly the advice that is being given to them.
Ministers arriving for a COBRA planning meeting earlier. A Public Health England message to hospitals, leaked to Channel 4 News yesterday, admitted testing for the virus here is largely restricted to those with the most serious symptoms. In Geneva, the World Health Organization spelled out that approach was dangerous and wrong.
You must test and isolate. You cannot fight a fire blindfolded. And we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries. Test, test, test.
We do intend to continue to scale up testing, but I think it's important to realise the scale of UK testing, which has been substantial.
Schools in the future might be closed, but the government said now was not the time for that or other tougher measures.
When you come to more extreme measures like curfews and so on and so forth that you'll see in some other countries, we're keeping all measures under review, and particularly, obviously, people will be thinking about school closures. There is an argument about school closures. We think at the moment, on balance, it's much better if we can keep schools open for all sorts of reasons.
The Japanese Prime Minister talked with Boris Johnson and other G7 leaders by teleconference this afternoon. The government insisted it was moving a bit closer to other countries' actions because of numbers on the ground, not international or internal pressure.
At the early stages of an outbreak, the numbers are quite small, so actually the precision with which you can predict exactly where you are is low. And I said that I thought we were perhaps 4 weeks behind where Italy was. I think the new numbers suggest we're maybe more like 3 weeks in terms of that. And that's really why and importantly, it looks like we're on the sort of fast upswing or just about to get there. and that's the reason to want to come in quite quickly with these measures.
Clearly what we're announcing today is a very substantial change in the way that we want people to live their lives, and I can't remember anything like it in my lifetime. I don't think there's really been anything like it in peacetime, and we have to accept that it's a very considerable psychological, behavioural change that we're asking the public, the nation to do. But I've absolutely no doubt that we can do it, that we can...
A change in people's way of life that threatens countless livelihoods to preserve life itself. Some of these measures, they said, could be with us not just for weeks or months, but maybe even longer. This is one hell of a jump, isn't it? It's only a matter of days ago, really, that we were being told the main advice was to wash your hands. And now this, which Boris Johnson admits is just about the biggest peacetime clampdown you could imagine. Repeatedly, Boris Johnson said in that press conference that Britain was leading the world in responding to the virus. And I think in research terms, there are pockets of work there which undoubtedly justify that description, but the rest of the world, or a big chunk of it, has been watching Britain and will probably now think that Britain is playing catch-up. Boris Johnson and the scientists say that isn't what was happening here. They were always going to move when the numbers on the ground dictated they should, and that, they say, is what has happened. One thing that really strikes you as you look at the potential economic impact of all of this is that we haven't even had a week since the budget that was meant to incorporate the risks of the new world we were moving into because of this virus. And you look at the challenges that business faces. Boris Johnson said at one point in the House of Commons, in that statement in Downing Street, that nobody should be penalised for doing the right thing. Well, if he really wants to make good that, well, then the numbers that were announced in the budget probably won't stand, and he'll have to go an awful lot further. One other thing that became clear in that press conference, Boris Johnson talked about there being other reasons for keeping schools open. People will be scratching their heads a bit about what those are. And it's quite clear that what they have in mind is what one of the top advisors called indirect deaths. The fear that you will have people going away from the emergency services to look after their children at home, in addition to those who are going because they're sick, and that could lead to people who should otherwise be getting normal care, not getting the care they need. Just another sign of the extraordinary new world we are entering.
Gary, thanks very much. Well, I'm joined now by Helen Whately, who's Minister of State for Social Care at the Department of Health. Helen Whately, just tell me first, what is the point of stopping going to the pub if your kids are going to bring back this disease from school?
Well, I think the overall approach that the country is taking, that the government is taking today, as we have been taking the whole way since coronavirus broke, is a science-led approach. So we are doing the best thing to protect lives. We've been taking steps which have been already delaying the spread of the virus, but we know that the numbers are going up, and that is why you've seen announcements which are taking us quite a significant step further in the action we're taking, and which, as the Prime Minister said, will make a big impact on people's lives. So one of the things that we're recommending is that people should reduce their social interaction, avoid unnecessary social interaction. That includes, for instance, not going to the pub.
So what is the point of that, though, if then your kids bring it back from school because you're not closing the schools and it's circulating in the schools and amongst teachers?
So something we have been looking at all the way through, again, is that for every step you take, you need to make sure that you're aware of the unintended consequences. So one thing, for instance, with schools is that if schools aren't there, the children aren't there in school, there's a question for parents at work where their children will be instead, and usually many parents will go to the grandparents to look after their kids. Well, actually we know, and as we've included in the guidance today, that over 70s are often amongst the most vulnerable and more likely to be at risk of complications from coronavirus. So
I do understand that logic, but
if
you're sitting at home with your kids sort of potentially infecting you, you might as well go to the pub.
I think that's, look, let's just try and be sort of well organised, and people want really clear communications about what are the best steps that they can take. The guidance has been stepping up over recent weeks and days, and let's be really, really clear about the steps we're asking people to take. And we're asking people to take these steps not only for themselves, because for most people, in fact, coronavirus, people will have symptoms and then recover, but we're asking people to take these steps particularly to protect the more vulnerable in society who we know are more likely to suffer complications. And hence the two things that have been announced today to do with isolation of the whole household if a member of that household has symptoms, and also limiting your social contact.
And you talk about stepping up the response. So you're asking people not to go to the pub, not to go to restaurants, theatres, etc. But in weeks to come, will you review making that a criminal sanction if people go out?
Well, I'm not going to speculate on what we will do in weeks to come.
But is that a possibility? Is it a weapon in your armoury?
I think what you have seen is the government taking step by step, taking the decisions as to what is the right thing that we should do for the country to protect people, to keep people as safe, to protect life.
So you're not ruling out criminal sanctions at some point down the road if you're not there yet?
Actually, I think the message that's really important to get out is for everybody thinking about whether to follow the advice is though you might not want to avoid social contact, you might want to be out and about, but remember that what we're particularly trying to do, and this is a national effort here, we all need to work together to protect the most vulnerable in our society, to control the spread of the virus, and that's happening hand in hand with increasing the capacity of the NHS to provide care for those who may need to be in hospital.
So the WHO today said that, just reiterated their message, test, test, test. Now, just 4 days ago, you said you were by and large just testing people who were ill in hospital. Now you say that you are testing people in the community. How are you doing that?
Well, the government has been and is continuing to ramp up the country's testing capacity. So a couple of days ago we were testing around 5,000 people a day. Today we're testing over 6,000 people a day. And we expect those numbers to keep on going up. A huge effort is being made there.
So how
at the moment we're having to prioritise testing those, for instance, who are in hospital, being admitted to hospital, also making sure that we can offer testing to those in care homes. But we want to be able to and expect to be able to spread testing more widely as the numbers keep going up.
But how are you currently testing in the community?
So you're probably referring to specific sampling that's done by Public Health England to make sure that we have a clear picture of the spread of the virus. But as
I'm just referring to what was said in the press conference. You know, the Prime Minister and his two advisors there said that testing was happening in the community. I just wondered how that was being done.
Well, I mean, as I've said to you, the figures I've just given to you are the ones that we have for the number of people who are being tested at the moment. We are particularly prioritising people in healthcare settings, and there's also some testing that is done to sample where the particular virus hotspots are.
So you're not
but the critical thing is that we are
determined
to ramp up the volumes of testing because we know that is an important part of our armoury. Of controlling the disease, protecting as many people as possible and saving people's lives.
Helen Waitley, thank you very much.
Well, now, our health and social care correspondent Victoria McDonald has been at the briefing in Downing Street. Victoria, what did you make of today's events?
Well, it's funny, isn't it? When you're a journalist, sometimes you think this is something that's happening to other people, and today it really hit home that this is something that is happening to all of us and will impact many of us. And this is an announcement that was to say to the public, this is not just about you. This is about the people around you, and particularly the vulnerable people around you, but also about protecting the health service. And that's been their mantra all the way through, as we need to lower this peak so that the NHS can cope. It did feel draconian. Now, they were saying, we're not going to make you not go to the pub or to theatre, but tonight we've just had the Theatre Society saying, the Society of London Theatre and UK Theatre saying that they are going to close theatres across the UK from tonight. There are no school closures. They're putting that down the line, as Kathy was just asking just then, because they still don't think that is the right thing to do now.
Now, what's the evidence they base these decisions on?
Oh, John, would you like to read it?
No.
It's quite hefty, but this is Imperial College COVID-19 response team. They've just published their mathematical modelling. They say that this extension of the social distancing to cover the whole population, not just over 70s, will dramatically reduce the number of deaths. They said the old model just was too much of a burden.
Now, everybody's talking about ventilators. The government says they're ordering more. How immediate is the need?
Well, just let me go back to this, just to go back to this modelling. Let's hear from one of the Imperial team who will tell us why they've made these decisions which relates to the ventilators.
We estimate that in doing so, our best scenario would only reduce the deaths by a half. And that unfortunately would leave us with an unacceptably large number of deaths in the order of 250,000. So the strategy now is to try to further reduce transmission, much as like the situation in China, to as low levels as possible. And that does mean much more drastic changes in our day-to-day behaviour. Ultimately, we think that will save many, many lives and the orders of magnitude lower. It will also importantly keep us within the healthcare capacity.
So ventilators, I mean, how acute is the need?
Well, you heard her talking about these pressures on the health service. We have been told that there are 5,000, but Matt Hancock today reiterated what they're trying to do for ventilators.
So we are increasing the number of ventilators. We've been buying ventilators for several weeks now, but we also need to manufacture more. And as we've discussed in the House, there is no limit to our appetite to buy ventilators, and there should be no limit to the capacity, to the appetite of industry to make them, because around the world, everybody is trying to increase their ventilator capacity.
Okay, there's been a lot of emphasis on ventilators, and it is clear we need many more, but what he was not saying there, which is critical, is that ventilators need staff and beds. And there are a lot of problems now about whether there are enough staff for these intensive care beds that will be required. And there is some more in some of this modelling. Again, there is a suggestion that 30% of people might need to go into hospital, and the number of people who will need that ventilation and the number of people who will die. So it's all about how you have a whole system working, not just the ventilators.
Victoria MacDonald, thank you. There's been another day of markets plunging across the globe as central banks battle to deal with the fallout from the pandemic. Major airlines have cancelled flights and are laying off thousands of staff. Paul McNamara, our business and global trade correspondent, is in central London for us. Paul?
Yes, this is really the day that many have been waiting for. You can't have stock market falls like we've had. You can't have flights grounded like we've seen without eventually there being job losses, and today they came. Even before we came on air, Manchester Airport Group, that's the group that owns Manchester Airport, Stansted and East Midlands Airport, announced enforced annual leave, temporary pay cuts, and here's the kicker, temporary layoffs. The boss there saying this outbreak is the greatest threat the UK's travel sector has ever faced. These are the real life consequences that underlie the turmoil we've seen in the global markets.
The extraordinary is becoming the daily. Minutes after opening, one US market fell so hard and so fast that trading was suspended for 15 minutes. Before last week, these so-called circuit breakers hadn't been used in more than 2 decades. And this was after yet another emergency interest rate cut by the US Central Bank. They're now close to zero, a move meant to reassure the markets.
That, oh my God, if we're lowering it, if we're shooting every bullet out of the chamber, leaving us at zero, is there worse economic news on the horizon than we think?
And hardest hit, the travel industry. Thousands of more planes will be joining these, parked up and nowhere to go. IAG, the owners of British Airways, today announced a 75% reduction in capacity over the next 2 months. Virgin Atlantic cut 80% of its flights and has asked staff to take 8 weeks of unpaid leave. One industry executive said there was no guarantee that many European airlines would survive. The good ones will, said the Transport Secretary, and hinted they may get government help.
good businesses that, if it were not for this coronavirus, would absolutely, flourish and succeed, should be enabled to survive through this emergency. So we've seen airlines in the past go to the wall, haven't we? But that's where there have been problems, perhaps managed poorly, or poor business models. That shouldn't be the case for otherwise viable businesses, actually, whether that's airlines or indeed sole traders.
There is one section of the economy the government is frantically trying to mobilise: the very specialised manufacture of ventilators for hospitals. Yesterday, the Health Secretary put out an all-arms plea for engineers across the nation to see if they can repurpose. A tall order say even those already doing it. SLE make 1,000 children's ventilators a year.
How easy is it then just to ramp up production?
It is very difficult. It's very difficult. There's a lot of training, a lot of specialised people work here, a lot of specialised components that we have to source coming in, and the design and the engineering aspect of it is particularly specialised. So all along the line, the whole sort of chain is very involved.
But if the government gets on the phone tomorrow and says, we need you to repurpose and start pumping out adult ventilators, would you be able to do it?
We would give it a shot. We would want to help. Don't want to be negative, but I keep pointing back to the timescales. To do it in such a short timescale is extraordinarily challenging.
Demand from around the world has spiked in just a few days, but this production line is no better protected than any other from the disease it's ramping up to fight.
A lot of the existing staff are under strain because we had 3 people go off this morning, or didn't report in this morning because they're self-isolating. So at the time of increased demand, our resources are being undermined from the same condition.
With the economy on life support, what a time to take on a job looking after it. Today, Andrew Bailey walked in for his first day as Governor of the Bank of England. His first pledge: to do whatever it takes to tackle the economic infection of this virus.
The economic effects that materialise during the period of COVID then get extended onwards by virtue of effectively the damage that's done to the economy, and that's something that we want to minimise and stop.
That may be his hope, but the markets cared little for it today. From Asia to Europe, the US and beyond, one thing joyed them all: a sea of red numbers tumbling down.
Look, there's only so many red numbers you can see before they start losing meaning. So what does all this mean? How bad is this? How does what we're seeing now compare to other financial crises? Well, this morning we sat down to crunch the numbers, and it's pretty bad. So we're now 18 days since the coronavirus crisis really hit the markets, and take a look at this. Here is a graph showing the drop in the FTSE 100 3 weeks after 9/11, down 14%. This is it after the global financial crisis in 2008. Down 19%, much worse. But this is how we're looking now as the pandemic takes grip. 33% down. These are big losses, bigger than we've seen in decades. The fallout from this promises to be big too.
Paul, thanks very much. Well, I'm joined now by Dame Louise Casey, who advises the government on homelessness, Carolyn Fairbairn from the CBI, and Francis O'Grady, who's General Secretary of the TUC. Carolyn Fairbairn first. We've already heard tonight that a lot of theatres are going dark. People advised not to visit pubs and restaurants. Should they all close temporarily?
Well, I mean, we are seeing the scale of this unfolding now, and it's real life for a lot of people and also for a lot of businesses. We are seeing a lot of businesses already having to shut their doors because of the new advice. And I mean, I think it will be up to every business to decide what they do, but I think we have to be very clear that action is needed at scale to support as many of those businesses as possible to survive
from the government.
From government, I think we have to recognise that urgent action is needed at scale.
And what do you mean by at scale? Give us a sense of the numbers you're asking the government for.
Well, I think we had a package of 12 billion last week in the budget, and that felt like a good sum of money at the time. But it was targeted mostly at small business. We're seeing actually some big challenges now facing bigger businesses as well. So, Kathy, I'm not going to put an exact number on it, but I think that urgent, people in a room really working through what can happen very fast. And I can't emphasise strongly enough how important speed is, because we're talking about businesses running out of cash, and that happens extremely quickly. Then you have jobs at risk and they will be hard to get back.
Francis O'Grady, do you agree that significant multi-billion government help is needed? Can you put a figure on it?
Well, look at what's happening in Germany, in Sweden, in Denmark, where they're not only supporting businesses to protect them through this difficult period, but they're putting money directly into the pockets of workers